The Harold Hamm Diabetes Center is in Oklahoma City and is part of the University of Oklahoma Health Sciences Center located in the heart of Oklahoma City. Well, the Diabetes Center is extremely important because Oklahoma, as states go, is one of the most afflicted by diabetes in the nation. We have a prevalence of diabetes in our population of roughly 11% and cost billions to the economy in terms of diabetes care.
This center is unique in that we have the support of philanthropy, largely through Harold Hamm, and a number of very generous donors that have helped us provide resources to bring great researchers here to Oklahoma, to bring great clinicians that are involved not only in the care but also in the prevention of diabetes. And so what this center does is it provides us more, a layer above just the provision of care to the community and to individuals, but also a chance to take diabetes care to a higher level through the research that we provide.
The COBRA stands for Center for Biological Research Excellence. It's a funded center grant by NIH. The goal is to bring people together to work in the same topic and train the next generation researcher, and also fund some core facility to facilitate diabetes research in Oklahoma.
The Today study that we participate in fact are among the leaders nationally, is an NIH-supported research project that has brought millions of dollars to the state of Oklahoma to address the new epidemic of type 2 diabetes in youth.
We actually have three areas of focus. One is the impact of fitness and training on children, how that affects their health. The effects of the mother's condition, whether she's obese or has diabetes, on the risk of children developing diabetes later, and the special problems of Native Americans that have a much higher prevalence of diabetes and obesity.
Our clinical care programs provide patients with individualized treatment plans from an entire team of multidisciplinary healthcare providers.
We have an adult diabetes transition program because this has been an area over the last 10 to 15 years that has acquired more attention. In seeing these patients, we provide them a portal of care to adult diabetes care. Now, pediatric care is usually family-centered, whereas adult diabetes care is centered on the patient. And many times, patients don't do well when making that transition. We have seen a revolution in the care of diabetes for young people.
The most recent initiative we have is focus on health literacy, and that involves starting a health information resource center here that's staffed by a full-time health librarian. It's a huge asset to our clinic as a whole, not just the Diabetes Center.
Our prevention programs take the fight against diabetes outside the research labs and the patient exam rooms to those who are at risk for developing diabetes and help them combat that risk through healthy lifestyle and diabetes risk education programs.
The program, Small Steps, Big Changes, addresses the overweight and obesity problem in Oklahoma by helping people change their lifestyle habits. So they're adopting a new way of thinking about food, preparing meals, they're becoming more physically active, and all of this is done, as the name implies, small steps, big changes, by taking it one step at a time, setting small goals, and with those small goals, they add up to big changes.
Effectively addressing the diabetes crisis requires the work of so many and from diverse areas across the world. Recognizing that, this year we established the $250,000 Harold Hamm International Prize for Biomedical Research in Diabetes, focused on encouraging novel research in the field and helping lead us closer toward a cure for the disease.
We're collaborating with researchers not only all across the United States, but around the world. And you know, Oklahoma's the place it should be. We're known for innovation. We're a pioneering state, and that pioneering spirit causes us to be the kinds of people who find new ways to get things done.
We're making a lot of very important advances in a lot of areas with a lot of diseases, and I think we will with this one. So are we going to find a cure? Sure, we're going to find a cure.